my primary aim is to help my patients. So what I would like to see happen is that my patients get a better life. So that's my sort of main goal, first case. And I've already seen that, because we've done the sort of the pilot, and we've seen that they got the same number of hypos but a better long-term blood sugar. And that's sort of the main drive force for me. So, and I think that's possible to obtain for my colleagues in other hospitals. So, so in that regard, I think this is sort of a good venue of obtaining a better life for diabetes patients, also in other hospitals, not only in Norway but across the world, because it's a good app. And and the main challenges are sort of the thresholds to use it or not use it, and make it simple enough that the patients use it, and by using it they acquire knowledge and they treat themselves better. Well, I see upon myself as a teacher first and foremost, and the patient is actually treating him or herself. Primarily I'm the teacher, and the role as a teacher is a challenge, and the app is a very good pedagogic tool for me to be a teacher, because you as a patient need to do the connections between the carbohydrate content in your food, so you need to learn how to assess it, and then make the connection to how much insulin you're going to inject for every meal. So getting a nice visual picture of those connections enables you as a patient to learn that. And when I could watch the same picture, I'm able to give you good advice in your sort of understanding of how this works. Well, the short answer is that yes, that was easy, and a little bit longer answer is that it was easy because part of my task is to have run courses for the patients related to teaching carbohydrate counting and how to calculate insulin doses. So we've been trying to make the connection between the app and these type of courses, and I have found the app and this tool very useful in order to get those points across to the patients. So we've sort of made the connection between teaching courses and introducing the app, so that the patients do have a very helpful tool in order to learn carbohydrate counting and insulin doses calculations in their everyday life as a diabetes patient. There are many tools with regard to carbohydrate counting and insulin doses calculation and blood sugar monitoring. And the point is that I think this is a good tool among all the other tools. So, and the new aspects is sort of that it's introduced into the cellular phone or the mobile phone, which most people use all the time. And the second thing is sort of the communication, that we could share data, which is really a huge challenge, because if we have to use 5 minutes to transfer data from the sort of small gadgets that people use to monitor their blood sugar, it's a little bit too much for us in everyday practice. So if it's possible for us to have the data there to share, then it's really a helpful tool.